LDCC paramedic program today. I'm Caleb Clifton. We got Evan Falcon here. He's going to be our patient. We're going to go over a comprehensive normal adult physical assessment. BSI, we do have our gloves on. The scene is safe. This is a medical call. Patient fell while he was outside doing some yard work. First thing I'm going to do is come up to the patient. I'm going to speak to him. Hey man, my name is Caleb. I'm a paramedic. What seems to be going on with you today?
Oh, nothing. I was doing some yard work. Kind of got hot. So
all right. So the patient is alert. He's oriented. Person, place, and time. First thing I'm gonna do is I'm gonna check his face. I'm gonna make sure there's. Take his hat off. Make sure check his eyes. Get my light. I'm gonna check it. Make sure that they're equal. Dilated restricted on both sides. Make sure there's not any kind of decap, BTLS. Run his head, scalp, ears, nose. Ask him to open his mouth for me. Checking for any kind of decap, BTLS, any kind of fluid drainage, cerebral spinal fluid, anything like that. Checking his skin color, condition, temperature, making sure all of that looks okay. I'm asking the smile for me, get a facial expression, make sure there's no droopiness on one side. Ask him what his weight is, which is 180, I'll note that. Check his breathing, making sure his breathing is a labor, make sure it's bilateral, equal on both sides. I'll go ahead and auscultate that, mid-clavicular, mid-axillary, make sure that he's got bilateral equal breath sounds like we want him. I'm going to look at his posture, look at his movement, make sure. Sir, can you raise your arms for me, raise and lower them, and your feet, can you move those from side to side and move your hands and your ankles, make sure your feet, make sure that everything is like it's supposed to be. I'm going to check his hygiene, grooming, making sure that he's a clean-cut fella like he's supposed to be. Check his level of consciousness. We've already determined that he is A&O times 3. Check his speech. He's already spoke to me. He's got good quality, great volume, articulation of words, fluency. Check his mood. He seems to be in a decent mood for the situation. He is oriented, a person, place, and time. He has good memory, recent memory. He did tell me what he was doing out in the yard. Sir, can you tell me what you were doing? When was the last time you did some yard work?
Earlier in the week.
Okay. Did you have any problems like this before?
No.
All right. So he's got good long-term memory. Check his vital signs. My blood pressure cuff. I'll check my vital signs. Check the blood pressure, pulse rate, pulse amplification. Check my respiratory rate, quality. Make sure all that's good. We've already checked our color, condition, temperature. Checking oil temperature. We'll get an oil temperature on him. Got an oil temperature on him. Again, we're noting all this as we go. Check his SpO2. We'll put a SpO2. Put a pulse ox on him. Check that. Make sure that's good. Again, we've checked our color, condition, temperature. We'll check his nail beds. Check for a cat refill. Make sure all that's like it's supposed to be. We've checked his head for any kind of decap, BTLS. We'll look at the back of the neck, look at the neck for any kind of JVD or tracheal deviation. We would expose the back. We would check the back for proper spinal alignment, make sure there's not any kind of deformities back there. Check his skin for any kind of moisture or anything. Check his vision, make sure his vision is clear and equal. Sir, can you read what's on the board up there for me? Can you see that? Yes. Okay, you can see that good. Can you follow my hand? Follow my finger for me? Just checking his ocular motor skills. All seems to be intact. Next thing we're going to do, we've already checked his ears. Sir, can you hear me? Can you hear that? Can you hear that? Can you hear that? Hear that? Okay, so he has good hearing. He doesn't have any problem hearing. Doesn't have any kind of deformity or air movement of the nose, no kind of wheezing, crackling, nothing of that sort. That's all pretty moving. Can you open your mouth for me? Okay. Does this hurt? Can you open your mouth? Does that hurt? All right. He has good range of motion in his jaw. Open his mouth. Check the mucus color. Make sure all that's good. The way it's supposed to be clear. Check for moisture and any kind of make sure his airway is patent. We've already checked his neck for JVD and everything like that. We've checked his ribs. Sir, can you take a deep breath? He has good movement in his ribs. Doesn't feel any kind of crepitness or anything. We've checked the lower airway. We've already auscultated the lower airway. everything seems clear and bilateral on both sides. We'll feel his pulse for solid rhythms, rate and quality, like we've done earlier. We'll listen to his S1, S2 nodes, make sure they're sounding like they're supposed to be firing off correctly. Check his arterial pulses for moral. Check his abdomen. We'll expose his abdomen. We'll palpate. We'll auscultate. Check him for any kind of DCAT, BTLS. We've already checked his back for any kind of deformities, open wounds, DCAT, BTLS, things of that nature. Check his pelvis. Check his pelvis by checking the stability of it, making sure that it's intact. Check the legs and the feet. Check his range of motion. We've already done that. He's able to kick out. Sir, can you push against my feet for me? Push against my hands with your feet. Yeah, he's got good range of motion. He's got good strength in his legs. Can you do the same thing with my arm? Push is good. Can you push in for me? Push out. Do the same thing with your feet here. Push out against my arms. Push in. All right, he's got good motion like that. Checked his dorsal, his pedal pulses. Those are all good. They're there. Checked his brachial pulse and his radial pulse and his carotid pulse. They're all there. That's about it. I'm done with this station.